Should I be experiencing pain after an injury or surgery? This is a very common question that I get from my patients, and it can be sometimes very difficult to understand what to expect. So in this video, I'm going to help you interpret your pain as you go through the rehabilitation process. My name is Fred Begaris. I'm a sports and spine medicine physician in Virginia Beach, Virginia. Let's get started. The first question I think we have to ask is whether or not pain after an injury is normal. The short answer is yes. I think that pain or even discomfort is normal after an injury or some sort of surgery. It doesn't necessarily make a difference from my standpoint if we're talking about the neck, the shoulder, the back. Overall, during the rehabilitation process, pain is expected and can be normal. The next obvious question is, well, how bad should it be? The way that I would measure pain is by 5 different parameters. Number 1 is provocability. Number 2 is duration. Number 3 is recovery. Number 4 is tolerance. And number 5 is trend. The first parameter is provocability. What I mean by provocability, it's almost like how triggerable is your pain. As an example, if you are sitting down and you go to standing and your pain goes from a 0 to a 1, that is significantly different compared to if you go from a 0 to a 10 with that same type of activity. If your pain is so provocable or so triggerable where the pain level is not well controlled, that might be a sign that that is where you start off your general activity, or you might need to cut it in half. So working on your sitting tolerance and your standing tolerance, and then you can go back to see how sitting to standing will actually feel. Hopefully by that point, that particular movement that you're trying will not be as provocable. The second parameter is the duration of pain. Anytime you're introducing a new activity, I would expect there to be some amount of discomfort or pain. Now, that movement that triggers it, the duration of pain shouldn't last that long, meaning that if you were, let's say, running and all of a sudden you felt some pain in your knee, as soon as you stop running, I expect that pain to almost immediately go away. If you ran, again, that same distance, but it took the entire day for your knee to calm down, that is a sign that not necessarily damage has occurred. However, it might be a sign that that might be pushing it just a little bit too much at this point in time. So as opposed to running 5 minutes, you try and run 3 minutes. The third parameter is looking at overall recovery. Again, if you are starting a new activity, I expect most movements, exercises, interventions to recover within about a day. Some stiffness, discomfort is normal, but I do not expect it to be so severe that it limits your ability to do the same activity again the following day. The fourth parameter is looking at tolerance. Tolerance to movement and also exercise. It's hard to make people's pain go to 0 during the rehabilitation phase. So on some level, you almost always have to accept that it's going to be there. So a marker of improvement is, let's say that you're able to walk for 10 minutes, but your pain level is about a 7. That's pretty good. If the week before you could only walk 5 minutes and your pain level was about a 4. So not necessarily that you want to push it to that 7, but again, the fact that you could actually work longer and tolerate the pain is actually a marker that things are generally improving. So that I would take as a good sign. For you overachievers, I wouldn't try and push it too far and too fast, because again, you might run into the recovery part of things, or the provocability might start to come back. But again, just a general parameter to monitor during your rehabilitation. The last parameter to monitor is the general trend. The road to recovery is not completely smooth. It's not just all the way down. There is going to be some bumps, some setbacks, but overall, the general trend should be heading down. As long as your symptoms are improving, that's really kind of what I would focus on. Now, in terms of, is the pain that you're experiencing a sign that something's going wrong? Overall, I would look at not just the pain number, but all the parameters we just discussed. If you're starting to notice that the provocability or the duration of the symptoms or your tolerance is starting to head in the wrong direction, That doesn't necessarily mean that there's something structurally wrong, but I do think this warrants a little bit more investigation. It's not always a structural issue. However, it might be a programming issue in terms of your overall rehabilitation program, looking at the intensity of the exercises and duration, and maybe certain exercises need to be added or taken out. I don't think it's useful to only look at just the number. You really have to look at the entire picture. So hopefully these parameters will give you a little bit more guidance. I know that the rehabilitation process can be very slow and frustrating, but as best as you can, try and look at the bigger picture of things. So the pain number, but look at your overall improvement with respect to these 5 separate parameters. I hope this is super helpful to you guys. Please let me know if you have any questions in the comments. Take care.